Hello, I'm Dr. Robert Lelouch, a board-certified OBGYN physician with over 30 years of clinical experience. So, how come our hands and arms get numb during pregnancy? So we're going to go over that and give you some general background information. You should understand that this is the common explanation. However, there may be exceptions, and if it's causing troubles or some of these maneuvers don't help, be sure and mention this to your healthcare team, okay? So, as you get further along in pregnancy, you get some swelling. The swelling happens for a variety of reasons, but one of the main reasons is that your blood vessels dilate a little bit, and as they dilate, that provides more circulation to help feed the baby, help get blood in and out of your uterus. But because they dilate, they have little valves in them, and those valves become leaky. Instead of closing, they spread apart, they become leaky, and that's why you get a little swelling in your legs, and then you can eventually get it in your arms. Well, there are places in your body where there are restricted passages, and one of those is in your wrist. You've got some ligaments and tendons in here that go through restricted space, and because of that, as you swell, it crowds them a little and can put pressure on the nerves and can cause some numbness in your hands. That's called carpal tunnel syndrome. Or all the way up to your arm, you can have some numbness. And that happens as you get further along. It also happens more the more activity you do. So if you're a secretary where you're on a computer all the time typing a lot, or if you're a server who's using your hands all the time and holding, that can get pretty bad. It can get to the point where you start dropping things. You might notice it gets worse when you eat a lot of salty foods like pretzels, Doritos, salted peanuts, Chinese food, Mexican food. Those can make it a little worse. It can take a day or two for it to get better. There are other more unusual causes, especially one side or the other, and certainly you need to go over with your healthcare team as I've specified, but at least you can understand why this is, why it's occurring on the average for pregnancy, why it gets worse as pregnancy goes, and how it usually resolves in a week or two after you have the baby. I hope you found this helpful, and please feel free to post some questions. Thank you.